guys, how are you? I hope you're all doing great. So, INE CT is near as well as NEET PG is also coming up. I always tell and I'll keep telling you till this is a very critical time for us. We have to give our 100% now in order to succeed in what we are dreaming for. There is no pause or no chance or no, you know, you cannot tell any reason. This is not a time of giving any reasons for what we are supposed to do and if you are not doing that, right? Give your 100% in this, right? In this video, I try to make some MCQs on bishop score and I'll be discussing about the bishop score, guys. So welcome to the platform of Dr. Bhatia Medical Coaching Institute and e-Gurukul. Myself, I'm Dr. Ramyasree, your OBGYN guru. Bishop score includes all except. So what are all the different components we have in the bishop score? So bishop score includes dilatation, station, consistency of the cervix, length of the cervix and position of the cervix. So you can remember it as thus clap. Thus clap. So D stands for dilatation of the cervix. S stands for station of the fetal head. C stands for consistency of the cervix. L stands for length of the cervix. P stands for position of the cervix. So you can remember it as thus clap. Thus clap. Okay. So dilatation of the cervix is included in the bishop score. Length is also included. In the olden bishop score, length used to be called as effacement. But now in the modified bishop score, length is called as effacement is now called as length of the cervix. So normally the cervical length is 4 centimeters. So from the 4 centimeters, it has to become 0, guys. Okay. It includes position of the cervix, but it does not include type of maternal pelvis. So what is not included in the bishop score? Type of maternal pelvis is not included. So this is the modified bishop score 0, 1, 2, 3. Dilatation and length are ulta, guys. So when dilatation is closed, you get a score of 0. When length is more than 4, you get a score of 0. Whereas when dilatation is 5, you get a score of 3. When length is 0, you get a score of 3. Dilatation 1 to 2, you get a score of 1. Length 1 to 2, you get a score of 2. Dilatation of 3 to 4, you get a score of 2. Length 3 to 4, you get a score of 1. Consistency of the cervix. So consistency of the cervix, if cervical consistency is firm, you give a score of 0. If cervical consistency is medium, you give a score of 1. And if cervical consistency is soft, you give a score of 2. Similarly, position of the cervix, if it is posterior, you give a score of 0. If it is in the middle, you give a score of midline, 1. And if it is anterior, you give a score of 2. Head station, -3. If it is high up, you give a score of 0. If it is -2, you give a score of 1. If it is -1 to 0, you give a score of 2. If it is +1 to +2, it is a score of 3. A bishop score of 8 or more. A bishop score of 8 or more is considered to be, actually one more point we have to remember here is if they're having prior vaginal delivery, if any prior vaginal delivery or preeclampsia, then you have to give a score of +1. If they're having no prior delivery, if they're having prolonged rupture of membranes, or if it is a postterm pregnancy, you have to decrease one number from the score. You have to decrease one number from the score, right? So this is something new which is added to the modified bishop score, right? So dilatation and length, remember they are ulta. Consistency and position are having only 0, 1, 2. So firm, medium, soft. posterior, mid-post, anterior. So there are only 0, 1, 2. Only head station is something which you have to remember. So head station mein -3, 0, -2, 1 score. Where will you get the score of 2? 0, 2, -1, score of 2. +1 and +2, you get a score of, you get a +1 and +2 score for 3. Okay? Right. So total score comes as 13. So in the total score of 13, score of 8 or greater is considered to be favorable for induction, and chance of vaginal delivery with induction is similar to spontaneous labor. See, B looks like 8, no? So score of 8 or more is considered to be favorable for induction, and chance of vaginal delivery is similar to spontaneous labor. A score of 6 or less is considered to be unfavorable. If an induction is indicated, cervical ripening agents may be utilized. So score of 6, you have to use cervical ripening agent, 6 or less. So ripening agents means the best drug for cervical ripening is dinoproston, which is PGE2. And the best drug for induction of labor is misoprostol, which is PGE1. Simple, all of you will remember now. Most important component of Bishop score is dilatation, guys. The more the dilatation, the better. Okay. All of the following are used for induction of labor except. So PGE1 misoprostol is used. PGE2 gel dinoproston is used. So I told you dinoproston is best for ripening. PG1 misoprostol is used for dilatation, right? But PGF2 alpha, that is carbopros, that we don't use as an induction of labor. All of the following drugs are effective for cervical ripening during pregnancy except prostaglandin E2 can be used, that is the best. Oxytocin also can be used. Misoprostol also can be used, but they are not effective. Progesterone can't be used for cervical ripening. It mainly helps in the relaxation of the uterus and to prevent the labor to happen. Which one of the following method for induction of labor should not be used in a patient with previous lower segment cesarean section? Prostaglandin gel, prostaglandin tablet, stripping of the membranes, oxytocin drip. So previous LSCS never use misoprostol, which is a prostaglandin tablet, because it increases the risk of uterine rupture. So these are some possible questions which we can get in the Bishop score, right? So I hope you have all understood the Bishop score. So this was a short video on the Bishop score, guys. Okay. So remember it as thus clap. So D stands for dilatation, S stands for station, C for consistency, L for length of the cervix, P for position of the cervix. So that's clap. Bye guys, all the best. Keep studying.